Hello, it's Dr. Chris Nowinski, co-founder and CEO of the Concussion Legacy Foundation. Welcome to episode 3 of the Concussion Game Plan podcast and part 2 of our conversation with Dr. David Dodick and Carla Ciccone, focused on the physical symptoms of concussion. We want to jump back in, starting with a look at visual symptoms after concussion. We know visual impairment and dysfunction is common after concussion, and symptoms can be painful and disorienting.
It was the type of feeling where, like, if you looked at your computer screen for like 48 hours straight without stopping, and you got like the worst eye strain of your life, just your eyes are exhausted, all you want to do is shut them for a little bit of relief, and you can't, but it felt like there's like a headache in your eyes, like in the back of your eyes.
A headache in the back of your eyes is a great way of describing it. Carla Ciccone is a Toronto-based writer who suffered a concussion after a waiter carrying a tray of plates slammed into the back of her head at a restaurant. Dr. David Dodick, a professor of neurology who runs the Concussion Clinic at the Mayo Clinic in Scottsdale, Arizona, tells us patients often report having blurred vision and trouble focusing.
When they say, I can't sit in a car because as things start going by me, I get dizzy. That could be a visual problem. Or they say, when I walk down a grocery aisle, I get dizzy and disoriented. That could be a visual problem. And then sometimes they just can't quite track things in their visual world. So that's something they complain about. Sometimes they complain of actual frank double vision, where they see two things either side by side or two things, on top of one another. That's not terribly common, but it can occur. So it's important when someone says there's something wrong with my vision to figure out exactly, again, what it is they mean by that, because the treatment for it is going to depend on where the problem is. The thing about concussion is that it's an injury that can affect different areas of the brain in different people. And the thing about vision and the thing about ocular motility and the fact that we take for granted when I look up, look down, look side to side, I don't even think about that because it happens so easily and spontaneously, but that's very complicated anatomy. And the anatomy of vision and the anatomy of eye movements is distributed throughout the brain. And what I mean by that is at least half of the brain's pathways, and we're talking about 200 billion cells, each of which make 10,000 connections to 10,000 other cells. It's really complicated. But more than half of those brain pathways are dedicated to vision and eye movement. That's profound. What that means is that it's almost impossible to place an injury in any one location of the brain or brainstem without affecting vision and eye movements. And that's why vision is so commonly affected after concussion.
To treat these complex vision symptoms, it's important to find the right type of specialist.
The help that you need may come not even from necessarily an eye doctor. I mean, it's obvious to think that if I have a problem with my vision, I'm going to go to an eye doctor. But when you go to an eye doctor, they do what they do and they do it very well. And they look in the back of your eyes and they see that the eye itself looks healthy and your visual acuity looks normal. You got 20/20 vision and your eyes look healthy. That doesn't solve the problem. And so you really need to be seen by either a neuro-ophthalmologist who has expertise in this area or a concussion program where they have therapists and experts in the vision and oculomotor system who can initiate exercises. Sometimes they'll put prisms in your lenses and things like that. So sometimes there are techniques and tricks like that they can use. But oftentimes it comes down to training the visual system to adapt to the injury and to overcome. And in the vast majority of cases, that happens. It may not happen overnight, but it happens over days or weeks. But usually the visual symptom is something that's you can rehabilitate. But you have to pressure test the system by doing certain exercises and visual therapies that actually enhances and facilitates and speeds up that adaptation that would normally occur in the brain anyway. You're just trying to move it along. Sometimes these visual exercises and visual therapies are not fun because they can cause you to be dizzy. They can make your headache worse. They can cause you to feel nauseated and imbalanced. And it's like, wow, I feel 10 times worse after doing that. But it is important to sort of push through it because you force your brain to adapt to the injury. And not to the point where you're debilitated by your symptoms, but it's perseverance and persistence is important. So recognize the fact that you might feel a little bit worse when you first start out with some of these visual exercises and visual therapies, but know that, relief is around the corner. Your brain will adapt and you will recover and improve from this.
For Carla, recovery was all about learning the balance of positively stimulating her brain without pushing things too hard or putting too much pressure on herself.
There were days that I tried to just go back to my normal routine or go back to working on my computer because that's what I do. And I just really wanted to get better. And you want to test the waters of how bad am I? Like, let me just see. And when I did that, it does just set you back so much farther. I would wake up the next day or even just immediately like have to go lay down because I had made my headache that much worse by staring at a screen. And I'm admittedly not a sporty person, but definitely if I pushed my body beyond its limits, I got physical reminder right away of why I was supposed to be resting. Headaches got worse, vision got blurrier, and it makes your recovery that much longer. And I think that was the scary part for me because I noticed right away when I would try to push myself that I would get that much worse right after. I wish I would have known that it's okay. It's okay to not feel okay, and it's okay to not know exactly when this is going to wrap up and I'm going to feel better again or back to my old self, and that it's a process. Like it's a process of talking about what's going on more than you're probably comfortable with. I know you're supposed to be able to tell your doctors anything, or technically you should, but sometimes it's not comfortable to tell your doctor, my concussion has made my thoughts turn dark and I'm really depressed. And those things don't come naturally to us sometimes. So I would have told myself to just relax about that, talk to as many people as possible, advocate for yourself, and just be patient with yourself and go really easy on yourself. Treat yourself like you would treat like a little baby that you were taking care of, and pretend that you are that little baby. It's just like, it's a weird way to think of it, but really, like when your brain gets hurt, you're kind of back to square one, and you really need to nurture yourself as much as you can.
Being kind and understanding with yourself throughout the healing process is key. And for parents and caregivers, your love, support, and compassion can have a direct impact on how your loved one recovers.
If I'm talking to a parent or someone who's supporting someone with concussion, first of all, it's an understanding and an empathy that this is real. It's biology, not psychology. And although you can't see it, feel it, or touch it, what they're telling you and what their experience is absolutely real. And it's not due to, stress or anxiety or some other psychological problem that this is often attributed to. This is a traumatic brain injury. And many of the symptoms that people experience, including anxiety and depression, are related to the injury itself, to some extent from the devastating impact that it's had on their life, but also as a manifestation, as a symptomatic manifestation of the disease, of the injury itself. So empathy and understanding that what they're telling you is absolutely real. Number two, don't accept any explanation to the contrary. So if you're seeing a healthcare provider who tries to chalk this up to just stress or depression or some other mood disorder, don't accept it. Find somebody who has expertise, who understands the injury and is used to looking after people who have post-concussion symptoms. So find the right person and don't give up until you've found the right person or the right team to care for you, because the better and the more aggressively this is managed up front, the less likely it is that you're going to be susceptible to the next one, and the less likely it is that your life is going to be impacted long-term from this. So help them find the help that they need, and don't accept no for an answer. And if it doesn't sound right to you, listen to your gut instinct, listen to yourself.
Great message there from Dr. Dodick. We'll be right back. If you need help finding the right doctor or the right team to treat your concussion and post-concussion syndrome, we're here for you. The CLF Helpline provides free, personalized support to those struggling with the outcomes of brain injury. The helpline also has a mentorship program that connects those suffering with a peer support volunteer who has had similar experiences as a patient or caregiver. Submit a request today at concussionfoundation.org/helpline, and a dedicated member of the Concussion Legacy Foundation team will be in touch with you as soon as possible. Two of the most common concussion symptoms we haven't touched on yet are the ones that make it hardest to live a normal life after concussion: light and noise sensitivity.
So imagine if you were being interrogated and someone was just, you know how obnoxious it is and offensive it is to have a light shined in your eyes. You immediately want to move away, right, and avoid that. Imagine if you were in a car and you had a really good sound system and you just cranked it up to the very, as high as it could go. You can't take that for very long, right? So it's like, the volume of both sound and light has been turned up significantly, even though nobody's adjusted the light and nobody's adjusted the noise. So that's what sound and light sensitivity can feel like for people. And you can imagine if someone's having both light and sound sensitivity, it's hard to be in the world, right? Because there are lights everywhere and there is sound everywhere. And so you want to there's a reason why people retreat to a, quote, quiet, dark room, because the light and sound is so not only obnoxious, but actually it exacerbates all the other symptoms. So exposure to light and sound not only is offensive, but it amplifies the headache, it amplifies the dizziness, and it amplifies the nausea, and it amplifies the imbalance. And why is that? Because the brain is so interconnected. We have what we call sensory integration centers in the brain. So if I have pain in my head, whether it's from a head injury, or I have a migraine headache, or I have meningitis, or I've just had a ruptured aneurysm, the first thing that's going to happen is I'm going to have severe pain in my head. The next thing that's going to happen is I'm going to be sensitive to light and sound, and I'm going to be nauseated. Why? These networks are interconnected. And once you upset one area in the brain, immediately it's talking to other areas in the brain. So when you have pain in your brain, the first thing it starts doing is it starts talking to all these sensory integration networks, so that normal movement is perceived as unsteadiness, normal light is perceived as a spotlight in the eye, and normal sound is perceived as like a gunshot. Everything is louder, noisier, brighter. Even smells can be more offensive, right? I can smell something 10 miles away. The sensory environment is turned up, and it's very hard to function in a world like that. It's due to the functional connectivity between these areas of the brain. Sometimes wearing sunglasses can help. Sometimes there are special type of lenses, they're called FL41 lenses, that can actually filter out the most offensive spectrums of light in the light spectrum. So it might filter out red light or yellow light or white light, for example. Oftentimes, treating headache can actually make sound and light sensitivity much better. So if I treat headache and I treat the visual system and I treat the vestibular system effectively, then all of a sudden, all the other symptoms start to die down and dampen down, right? So light is now less offensive, and sound, the light and sound sensitivity isn't as prominent. So trying to avoid situations where there's bright light and sound, maybe using certain types of lenses that can help, but ultimately it's treating the other problems. It's very seldom do I see people who just come in and say, "Doc, I can't stand the light. That's the only problem I have, is I just can't stand the light." It's never like that.
The last physical symptom we'll touch on today is sleep. Concussion can affect our sleep in many ways.
Some people become what we call hypersomnolent. They always want to sleep. They can't get enough sleep. Other people can't get to sleep, so they become, insomniacs. So sleep disruption is common, and it can be different in different individuals. It occurs because the anatomy that controls sleep and the biochemistry in the brain that controls sleep is tightly regulated. And if you disrupt those areas, if you disrupt brain chemistry, and if you disrupt the anatomy of the brain, you can obviously disrupt the normal circadian rhythms and the normal anatomy and biochemistry that controls sleep-wake cycles. So that's why it occurs. And some of the areas of the brain that are affected by concussion happen to be areas that are intimately involved in the control and regulation of sleep-wake cycles. The first thing that people can do about it is to try to avoid factors that can amplify the problem. So if you're having trouble getting to sleep and staying asleep, then avoiding things like a lot of caffeine can be helpful. Taking things that are relatively natural that can help you sleep, like melatonin, for example, could be helpful. Melatonin is something that's gotten a lot of interest recently because it has anti-inflammatory properties, and it seems perhaps maybe neuroprotective after concussion, and it helps sleep. So melatonin could be helpful as a over-the-counter preparation that could actually help you sleep. The other thing is that all of these other symptoms that you're experiencing could be making it difficult for you to sleep. So headache, for example, if you have a severe headache and you're nauseated, it's very difficult to sleep. It's difficult to get to sleep. It's difficult to stay to sleep. So managing these other symptoms can be effective in helping you get to sleep and stay asleep. Keeping regular sleep-wake schedules. Yeah, it's very tempting to have a nap today, but I'm going to try to stay awake and go to bed and try to wake up at the same times, even though that may be difficult. I think it's important. So sleep hygiene, that type of sleep hygiene approach is important.
Caregivers who know their loved one is struggling with sleep can play an important role in making sure they practice good sleep hygiene.
Encouragement, encouragement. If people do the sorts of things that I said, and when you go into the bedroom, there's no cell phone, there's no laptop, there's no computer, there's no television. So you're in bed to sleep. You maintain normal sleep and wake cycles. You avoid things that can make it worse, like caffeine, late night snacks, things like that. You take, supplemental melatonin or things like that can help with sleep. You manage other symptoms. I think it's just an awareness that the right environment is necessary to help someone sleep. Relaxation therapy, stress management, these things are also helpful for sleep. Cognitive behavioral therapy. So all of these things, if you write down the list and continue to try to encourage, because sometimes if you have a high school son or daughter at home and they're used to going to bed late, waking up late, they've got their phone in bed with them, they're snacking in bed, they're talking to their friends or texting their friends. All of these things, while it seems like that they're going to do more of that if they can't get to sleep, it becomes paramount to stop that for a period of time until you reestablish some normality and you get over that period of acute post-concussion symptoms. I guess if I were a parent, I would say, look, it's short-term pain for long-term gain here. Yeah, we can't continue to operate like you've been before you were concussed. So for the next 2 to 3 weeks, we have to stick to the schedule because then you can get back to your normal life. But if we don't, this can linger and can persist and make life much more difficult long-term. So short-term pain for long-term gain.
We like to end each episode with a big dose of hope. If you're listening right now and struggling with any of the symptoms we touched on today or others, please know that you will get better and you are not alone. Carla recommends doing everything you can to find community.
When you're dealing with the symptoms of a concussion and you're alone, being alone with your thoughts and headaches and whatever else you're experiencing can really get you to a dark place rather quickly. And it's really important to seek help from your community, from your doctors, from whoever you can, because having other people around is really what helped me. And advocating for myself to my doctors, I was very hesitant to do anything. It took me getting to a very, very low point to even seek out treatment at all. But it really was for me making tiny baby steps and doing new things in a safe and slow way that led to me eventually starting to heal and get better. And a big part of that was talking to people, talking to different doctors, talking to friends. Even I talked to a couple of strangers who had been through concussions before, just to open yourself up as much as you can. Not in, it's scary at first, but to try to do it and try to find safe spaces, doctors that you feel comfortable with, people that you know well or that come recommended so that it can take some of the pressure off. But I think definitely seeking help and in community is, even if you're an introvert, I'm an introvert by nature, and it did help me more than probably anything, because there's only so much you can do for yourself by yourself. I'm here to tell you that it does get better. Just get through the day, do what you need to do to relax and get through each day.
For Dr. Dodick, it's all about the 3 Ps.
Patience, perseverance, and positivity. Patience that you wish this would just go away tomorrow, but it may not. This is an injury that may take a little time to recover, and it's different for everybody. So your friend might have gotten over their concussion in 2 days. 2 weeks down the road, you're still experiencing symptoms. It's different for everybody. So you need to have some patience. You need to be positive in that the vast majority of people get better. And then perseverance. And by that, I mean, you have to stick with what's been recommended, but you also have to persevere in finding the right provider or the right care team. And that is crucial, because it's difficult for people to get better on their own if they're not provided with the education, the support, and the right sort of treatment approaches that's tailored specifically to their individual needs. And if you're not getting the respect and support and care that you think you should be getting, then you have to move on. You have to persevere. You have to find the right team. And there are really excellent providers out there.
A big thank you to Dr. David Dodick and Carla Ciccone for joining us for both of our physical symptom episodes, and thank you for listening in. If you have any questions about what you heard today or are looking for more information about concussion or post-concussion syndrome, please visit our website, concussionfoundation.org. If you enjoyed this episode, please leave us a 5-star rating and review and subscribe to help us reach others who are struggling. Coming up on episode 4,
when you have a concussion, all of a sudden you have very low levels of what feels like cognitive stamina, then everything can really become an issue in terms of not being able to handle or cope with situations.
the amazing Dr. Christina Master joins us to break down the emotional symptoms of concussion and explain why mental health issues like the depression Carla touched on in today's episode are common after concussion. Until then, I'm Dr. Chris Nowinski. Keep fighting.